Today, we have a deep dive into a really high-stakes moment in American public health. A major federal advisory panel, the ACIP, they advised the CDC voted for a massive change in vaccine policy.
And in response, the entire medical establishment, almost in unison, just said, no, we won't follow that.
It's an incredible situation.
It really is. And it's a perfect case study in what happens when policy and overwhelming clinical evidence just diverge. Our mission today is to give you the sources and the context you need to really use your critical thinking here.
Okay, so let's set the stage. The topic is the hepatitis B vaccine. On December 5th, 2025, the ACIP voted to overturn a 34-year-old policy.
Right. They suggested delaying the first Hep B dose for all newborns by 2 months.
And the pushback was immediate.
Oh, immediate and universal.
Right.
Groups like the American Academy of Pediatrics, the AAP, they came out and said they would continue with the current proven schedule.
Which really begs the question, why is a 2-month delay considered so dangerous? What are the actual stakes here?
Let's get into the data, because the numbers are, frankly, pretty alarming.
Okay.
Sources project that this 2-month delay would cause at least 1,400 preventable childhood Hep B infections every year.
Wow.
And that translates directly into about 300 extra cases of liver cancer and 480 preventable deaths over the lifetimes of those kids.
That's just a staggering human cost. And I imagine there's a financial one, too.
A huge one. Over $222 million in extra healthcare costs annually. And, to understand what we're risking, you have to remember what it was like before this vaccine schedule.
Right.
The U.S. saw about 30,000 kids infected every year. And with newborns, 90% of those infections become chronic. A quarter of those children die prematurely. This vaccine is, without a doubt, one of our greatest public health success stories.
So the evidence for the current schedule is just undeniable, and yet the policy changed. Now, who exactly led the charge in rejecting it? It wasn't just the pediatricians, was it?
No, not at all. It was a completely united front. You had the AAP, of course, but also the Infectious Diseases Society, the obstetricians and gynecologists at ACOG, the American College of Physicians.
So basically everyone.
Everyone. We even saw major hospitals like Lurie Children's publicly state they would not comply.
And the argument they made, like the one from Dr. Kosielek, was that this recommendation came without any new research showing deficiencies in the current plan. It was evidence versus policy.
Exactly. And, this conflict really stems from how the ACIP members who pushed for this were selected. They were appointed by Robert F. Kennedy, Jr., who has been a very, very vocal critic of U.S. vaccine policy for a long time.
Okay, that brings us to a really crucial point, a kind of academic debate we need to clarify. A big warning from proponents of the delay was that doctors who deviate from official CDC recommendations could lose liability protection.
That sounds terrifying for a doctor.
It does, and this is where that critical thinking piece becomes so important. It's a really common misconception.
So how does it actually work? Well, as Professor Dorrit Rice over at UCSF Law clarifies, if multiple standards of care exist in the medical field, and the AAP's 34-year-old schedule is absolutely one, then following any of those valid standards is a sound legal defense.
So following the decades of evidence is actually the protection.
It's protection for both the patient and the physician. Exactly. And you see this reflected on the ground. State officials in Connecticut and Baltimore are focusing on maintaining access and just clarifying facts, not following rumors.
So if we pull it all together, what's the takeaway for you, the listener?
It's that the policy recommendation changed, but the actual evidence-backed medical standard of care did not. It's still supported by 34 years of overwhelming data.
Right. The facts on the ground didn't change.
Not one bit. And, that leads to a final, maybe provocative thought. One expert, Robbie Draveri, noted that most people see this vaccine as a good thing because they've seen the benefits themselves. They've seen hepatitis B all but disappear. So it raises this question for you to mull over. When the evidence is this clear, does that lived experience, that established clinical trust, ultimately become more powerful than a political policy shift?